Welcome aboard Lifelines with David and John, your guide to charting the transformative course of crisis intervention and the game-changing 988 Lifeline.
Welcome to the inaugural episode of Lifelines with David and John, the 988 podcast. So, John, you and I have been working together in this crisis space for over 20 years, and we're going to revisit that history, some of the pioneers in this space. We've had the chance to meet many of the visionaries, people who've used these services, provided these services, helped manage them and support them. If that applies to any of you, we want you to join us and be part of this family as we walk through both the history, the heart, and the future of a crisis services and system that feels like care and support, as opposed to what frequently we sort of default to law enforcement and hospitals. So Lifeline, the podcast, this is the start. We're going to be on YouTube and all of whatever you listen to your podcast on. So we hope you'll like and subscribe and follow us. And we're sponsored, John, by Behavioral Health Link. I'm proud to have been brought into this work by the founding partner, Greg Graham, back in 2002. Angela, that's when we met. Yep. And this podcast is sponsored by BHL. So Dr. John Draper, tell us a little bit about our sponsor and the work that Behavioral Health Link is doing.
Well, I'm happy to do that, David, but I also just got to add to your preamble, which I thought was really a great description of what this thing is all about. Because I have had a lot of people ask me, what is this podcast going to be all about and who's the audience for it? And some have been wondering, can I rigorously exercise to this? And I'm just telling you, if you're into Zumba, this podcast is for you. Yeah. But if you're into the BHL platform, which I am all the time, and I got to tell you about this, as David was saying, the BHL is the sponsor of this, but I'll tell you what really just makes this, my life at BHL so very happy. It's not only the people I'm working with, like David and my colleagues naturally at BHL, but also working on this software program, which is the future. And in fact, we like to say, step into the future with the Behavioral Health Link Call Center Hub. And I'm going to talk a little bit just about the Call Center Hub right now, because we've got we've got like about 6 different modules, and all those modules allow people to get care at different levels, and it coordinates care across the continuum of care. So with the Call Center Hub, that's where we start. We also have the Mobile Crisis Hub. We also have an outpatient scheduling hub. We also have a module for follow-up and a module for bed registry. But this one is about stepping into the future. And it's where advanced technology meets compassionate care, David. It's, in fact, with the BHL platform's Call Hub, the future is now, because it helps the counselor be fully in the present with the person in crisis throughout the interaction. It really revolutionizes crisis response by making it easier for the counselor to listen, engage, assess, and support every person in crisis, all the while making the required documentation seamless. And you know what else it does, David?
What else does it do, John?
But it also helps less experienced crisis counselors to stay on track. It just gently reminds them of next steps and recommendations aligned with the best practices of care. Because doesn't every counselor, when they're first starting, worry about screwing up? Well, this makes it easier for them to be with the person and not worry about screwing up. It just reminds them, hey, don't forget to do this. So the Call Center Hub is more than software. It's a commitment to transforming lives through better, faster, and more empathic response in those critical moments. So if you want to learn more about the software, just visit behavioralhealthlink.com.
John, thank you, and thanks to our sponsors. So, I wear a lot of hats, but I'm thrilled to be here as part of Behavioral Health Link, and I'm one of the partners and owners in the company and the work that we're doing. And John, I had the privilege to be with you yesterday and see some of this work firsthand. And wow, I wish I had had this support for Angela back 22 years ago, instead of Now we did have a system, Angela,
We
but
did.
yeah, I remember the binders with the what did we call those resource guides that we had on the desk?
I don't know that they had. Did they have a name? You mean the
Email
files?
folders? I don't remember.
Yeah, I don't remember. Just the binders.
Yeah. And
Yeah,
initially, Angela, it was the Fulton binder, but then we had the Clayton binder, and then we
and the
had the
cob.
Suicide Prevention Lifeline binder, and
Yeah, yeah.
it got more complicated as we went. So all
That
of that
sounds pretty
support,
binding to
John.
me.
What's that, John?
It sounds pretty binding to me, and that's exactly what you don't want to happen when you are doing a call. Like, wait a minute, I got to look stuff up, and I got to document this. You don't want anything to be in your way, and that is it's a challenge when you've got a computer there and a person that you
Yeah.
have to engage.
So this work is stressful enough as it is, John. In today's inaugural episode, we want to give tribute to those frontline crisis workers, and thrilled to have our guest today, Angela Hammond. Angela, you and I started the Atlanta Crisis Call Center back in 2002.
Yes. October to be exact.
Been a minute, Angela.
Hmm.
Were you there on that very first day? So the Fulton County started its crisis line in 1966. John, we talk a lot about Ed Schneiderman and the Los Angeles Suicide Prevention Center starting the first crisis line in 1958.
Yep.
Still in operation today with Dee Dee Hirsch. And they just proliferated all across the country. Atlanta started its call center
Yeah,
in
the 60s
1960.
were huge for starting crisis lines. Absolutely.
Yeah. But in 2002, Ernestine Pittman, Lynn Copeland, and the regional office of the Department of what at the time was Mental Health, Substance Use, and Developmental Disabilities, they looked to a new approach that was called the single point of entry. And
Correct.
Angela, we put that Atlanta call center together.
We did. I was the poster
October.
child, as a matter of fact. Yeah.
Yeah.
We had a brochure. Hmm.
We had a brochure. That's right. So today, Angela, we're so thrilled you're joining us because we want to give honor to all of those crisis staff. If you're a crisis call, text, chat taker, you're a mobile crisis team going out into the community, under that bridge, into that apartment, dealing with that dog in the front yard to get to the front door. You're a crisis facility staff working third shift. You're a nurse managing a crisis stabilization program. This first episode is for you, and we went back to the beginning with Angela. So that's our program for today, John, and let's get it rolling. So, John, one of our first segments is our good news section. What's in the news? It's good news for crisis. And John, CNN just did an article about looks like the FCC is going to push forward geo-routing. So, John, tell us what geo-routing is and why that's good news for the network. The 988.
It's a huge deal, David. And really, the way the Lifeline works, when you phone that 988 or the old toll-free number, what happens is Vibrant, the administrator, takes that area code and the prefix of your phone number that you're phoning from, and then routes it to the nearest center that's associated with that area code. Well, guess what? About 80% of the calls are coming on cell phones, and people carry their cell phones everywhere they go, and they take that original cell phone number wherever they go, wherever they move to. So when I pick up this phone here in Brooklyn and I phone and I've got my old Texas number in there for some reason, it's going to take me to Texas. It's not going to take me to Brooklyn.
Yeah.
Now, if Brooklyn has invested in all these mobile crisis services and all these other fantastic services in the community that I could be connected to, if you connect me to Texas, those folks in Texas aren't going to know about all those resources in Brooklyn. In fact, if you're an emergency, they might say, well, my only choice is to call 911.
Right.
So that's a real problem. It's also a problem if we can't locate people who have just taken an overdose or something. So we need to be able to get at least as close as we can to the nearest 911 center, if not the exact one. So it's really important for us to have be routed to the nearest cell phone tower. That's what geo routing is.
Okay.
If it takes me to, regardless of my Texas phone number, to the nearest cell phone tower here in Brooklyn, it's going to connect me absolutely to NYC Well here in New York. So that's what we're trying to do.
Yeah, John. So I've still got Angela. What's your area code, Angela?
My area code is I have a 404 and a 770.
Yeah, so I'm still 404, and I've been in Arizona for a minute. So I'll get Atlanta. I'll get the call center in Atlanta if I call 988 right now. John, do we have a sense of how often that's the case? How many people are carrying a cell phone that's not in their area?
Well, I'm not sure exactly how many aren't in their area, but we did do when I was with the Lifeline, David, we did do a check on what happened in New York City, and we did find with specifically, in New York City's filled with transient individuals,
Right.
and we found that about something like 40% of the people who were calling were being routed elsewhere.
Yeah. So, John, and my intention in these podcasts is to give tribute to Atlanta and to Georgia. I lived there for 13 years. My kids were born there, and I'm back there about once a month now over the course of the time I've lived out here. So Georgia's a big deal for me. The routing is part of it, John, but geolocation, with 911, they get the precise longitude and latitude.
They do.
That's not under discussion right now for concerns about privacy, but talk a minute about that. Angela, you had calls, I know, when you worked with the single point of entry where you were concerned about the person's safety and didn't know where they were.
Oh, absolutely. That happened quite frequently. And one of the biggest times was, remember, during Hurricane Katrina, when we received calls from all over and our inability to really be of service to them in that crisis time.
Well, and Angela, there's probably a few times when you're working with somebody who says, I'm going to kill myself right now, or is just taking some pills, and they're unable to really tell you where they are. And so you don't know where they are, and they hang up, or they're just unintelligible. And so what do? A lot of times, of course, we can ask them where they are and they'll tell us, and that's great. But if they don't tell us and they can't tell us and they might be dying, then what do? I'll tell you what we do is we phone up 911 and we say, here's what's going on.
Right.
Can you ping this for us and hopefully find this person for us, because I don't know where they are. Yeah. And 911, who does have geolocation, they know exactly where these people could be, then they'll say, give me the number, and then they'll try and ping them. That is, if they allow themselves to do that. Most of the time, or a lot of times, they say, we can't do that. That they call it a HIPAA violation. It's not, but they believe it is, and so they won't do it. Other times, it's very difficult. And my discussions with the folks at 911 is they say, we hate getting calls from Lifeline when they say somebody's dying, and they say to our PSAPs, our public service answering points, they tell those 911 operators, can you look this up for me? And they don't know what to do because they're not asked to do that very often.
So but it's a challenging topic, though, John, because of there's so many areas of the country that don't have the mobile crisis capacity or the kinds of resources that would mean you might not have law enforcement on the door. So while we build this system out, those concerns from people with lived experience about privacy and overreach and more intrusive engagement than they want, we'll have to continue to grapple that. But the fact that we're talking geo-routing is a great step. Other good news is the crisis crowd survey.
Crisis crowd.
Dan, is it
Victor.
Yeah. So Dan was a crisis worker himself and has surveyed, I think it was a little more than 50 crisis call takers across multiple organizations, John, asking questions about adequate training and support, and the stress of the job and how easy it is to get the work done. So a little reminiscent, John, of those original meetings we had many, many years ago now, where Madeline Gould and Brian Mashar and John Califat were listening in and on calls. But this one's a little different. It's not talking about evaluation of the work itself, more the experience of the call taker.
Yeah, it's a great point. We expect them to listen to the folks who are in crisis, but in order to help them do that job, we have to listen to them and how hard their job is, so we can give them enough support so they can listen day in and day out. Angela, I wonder, just from your, what you remember about working as a crisis counselor, how important being listened to by your supervisor, being listened to by your other coworkers, how important that was for you in doing your job. How did you feel about that looking back?
Yeah, I think it was very important, especially because we were just starting off. This was a new thing. And so we were all learning as we went along. And so it was very important as we, gain knowledge from the clients themselves, the people that we were talking to, and from our experiences, that they understood the different nuances that came with this job, because none of us really knew. So it was extremely important.
Yeah.
So, John, let's go on to our trivia question. So we do an over-under. Angela, you know what an over-under is?
No.
So I'm going to ask a question, and John is going to take a stab at it, and you're going to say the true answer is over or under his answer.
Okay.
All right. So, John, here's the question. We're talking about the amazing crisis worker that deals with the ongoing, they work the middle of the night, they work the stress of this, and the reward of this work. But normally when we talk about first responders in the U.S., we're talking about police, EMS, we're talking about voluntary and career fire. How many first responders are there in the United States?
Ooh,
So,
of all of those?
yeah. So it's career
police,
volunteer,
fire.
career and volunteer firefighters, police, EMTs, and paramedics. What's your number, John?
Oh my
Number
gosh.
of people who work in that industry nationwide.
I don't even know what all the factors are that I would use to calculate that with. So this is going to be a huge stab in the dark, Dave.
Take a guess, and Angela will give us the over under.
All right. I'm going to say 10 million.
10 million. Angela, more or less?
I'm going to say less because I had a number in mind. I'm going to say under.
Angela, you're the winner of John, your record is 0-1 in the podcast. Angela,
I wanted to make Angela feel good, David. I'm glad I'm helping her feel good right now.
I was actually thinking a few million, maybe 2 to 3 million, something like that.
3 million sounds about right.
It's actually in between the two of you, 4.6 million.
Okay.
Our first responders, October 28th was National First Responders Day, and they mentioned that number. Now, I thought it was interesting. They didn't include 911 dispatchers, and 911 would say those folks are also first responders. And as we get into text chat and next generation 911, they will be virtually on the scene in ways I think it's going to be impossible to keep them out. That's another 100,000 who work in 911. So 4.6 million. However, Angela, no one yet is saying, like they should be, that 988 and crisis call center staff, mobile crisis staff, and crisis facility staff are also absolutely first responders.
They aren't saying that?
We don't say that yet.
Yeah.
Oh, wow.
Yeah.
I don't think I realized that.
That's the reason that you're here. So, Angela, let's introduce you. Angela, we started that Fulton County, City of Atlanta crisis line together. There were how many of us were in that office to start, Angela?
When we first started, there were 5 cubes. 4 were connected and 1 was off to the side. 5 cubes.
I actually was looking and I found the list. You and I were talking to try to remember everybody. Denise Lyons, of course, was a nurse who was on our team. Ellen Morris was a social worker. Seymour Shea.
Seymour Shea, yeah.
And Elated Terry.
Yep.
And of course, you and me. Bridget was our community liaison. Keely Foster. We hope to have Keely on the program at some point.
Okay.
Terrence Franklin
Mhm.
was part of that team. But Angela, tell us about yourself. Give us a little bit about who you are and your background and what you do today.
Okay. I'm actually a former school teacher who got into counseling just because of the relationship I began to have with my children, my students, and my parents. I'm originally from Chicago. I have been licensed as a licensed professional counselor since 1997. So I've been doing the work a long time. I've worked in hospital settings and community mental health and probably every setting that there is to work in. I currently work at a university at Georgia State in the counseling and testing center there as one of their therapists.
Right.
And I also, oh, I'm sorry.
No,
Go ahead.
and how long were you a crisis counselor, Angela?
Um, I forgot how many years I was there, David. Let me see. It had to be about 7 years. I'm gonna say about 7 years. Yep, I
Yeah.
worked as a crisis counselor.
And when we first met, Ashton, Miriam, they were how old?
They were probably about either the 3 and 5, or no, maybe 6 and 8.
Yeah.
They're 31 and 29 now. However old they were then. Yeah.
And what are they up to, Angela?
Believe it or not, Ashton is an LCSW in California.
I
That's
believe it.
great.
hmm
That's great.
Yeah, yeah, and
So
we're in education.
wonderful. Angela, one of the things we're going to do with our guests is to learn a little bit more about them, is to find out what they're a super fan of. It looks like from John's background there, he's a super fan of who's that? Who's that on the wall there, John?
All right, so yes, our whole family loved the show Friday Night Lights from way back, and my daughter fell in love with the character Tim Riggins, who was played by Taylor Kitsch, and it's still there. I mean, she's 24, and now she's in Los Angeles, I think, trying to hunt him down.
Yeah.
So yeah, that's who that is.
And Angela, I'm a super fan of a lot of things, but I don't know if I don't think you can see my Spartan man in the background. But
I can.
I'm doing obstacle course racing
Huh.
at my age.
Be safe.
What are you a super fan of, Angela?
Spartan race is not an obstacle course, Dave.
Well, two things come to mind. One is taffy apples. I love taffy apples. I mean, I'm addicted. And Grey's Anatomy. I'm a first day. Yes. Day one.
You
Yeah.
see them going together, Angela. It's happened, I'm sure.
So, Angela, it's been a minute, but we wanted to get a little bit of your reflections of what that was like. We were in the Citizens Trust Bank building.
Yes.
On the second floor. There was a 24/7 call center in Augusta that Behavioral Health Link operated. But we were 8 to 5. We were that small team operating in the city of Atlanta. What did you tell us a little bit about that experience and
Okay.
answering crisis calls? What was that like? And what do you remember about that experience early on?
Can I just add that I am back on the second floor of the Citizens Trust Bank building because Georgia State bought the building. And when we moved there, I couldn't believe I was in the same space. Can you believe that?
That is so. As we grew and took over, we took over second shift and then third shift and weekends. It became the full, and we transitioned from Augusta to our headquarters being in Atlanta. We moved from second floor to ninth floor, and we just kept growing, building out. And then when Georgia State bought it, it moved us, and we landed up on Peachtree and in that suite of towers up there. But that's crazy that you're in the same building, Angela.
And so the work of mental health still goes on in the second floor of the Citizen Trust Bank building. So good to know. So, I was thinking about it, and I remember when they were hiring for this, and a lot of people were resistant because when you start off as a clinician, what you don't want is someone that's saying, I want to kill myself. And so people were very resistant because at times you feel helpless in that position. But what I learned from working at Behavioral Health Link, and I also remember, John, when you came and you talked to us about the book, The Golden Gate Bridge book. Do you remember that
Well,
time?
there was the Golden Leap, or no, it was the Final Leap off the Golden. It was
Yes, the Final Leap.
the
Yes.
name of it, and it was the bridge was the movie, the documentary.
Okay. You talked to us about the
Bridge,
book.
probably.
Yeah. And I just remember that, and I remember the experience changing helplessness into more of hope. When, as I began to work at Behavioral Health Link, I realized how much more hope I was able to give to those, because when people call, a lot of them really, some of them are very, very serious, but a large majority of them just need hope and just need someone to help guide them in a certain direction. And that's one of the main things I remember, not feeling as helpless as I used to feel about crisis work, and being more of a hope about in crisis work. Yeah.
That's huge, Angela. One of I've heard so many, I mean, luminaries in our field, people who are, among the clinical leaders in suicide prevention around the United States, and they all say, the best training that I ever got in suicide prevention was when I volunteered at a crisis center. And it sounds like what you're saying is very similar to that.
Mm-hmm. Yeah, when you start talking to individuals and hearing their stories and what's really happening, you recognize that there's just a lot of work to be done, and that we're here to give it. We can help them. We can help them far more than people realize, and so a lot of people just kind of get to the end of their ropes, but when they can hear that there's more rope to be given, and that's what we do. Yeah, we make a difference. We make a difference.
Angela,
Absolutely.
I remember, and you and I talked recently about this call, but I remember you talking about a call of a young African American woman who was calling because she was in distress, that she had been accepted to 6 Ivy League colleges, Ivy League universities, and had 6 days to make a decision about which one to go to. Has that come back to your memory yet, or is that it? It had to be you, Angela. I'm concerned. I'm sure it was not Ellen, and I don't think it was Elena.
Okay. Vaguely, after we hung up, I thought about it. And I guess, David, what that just speaks to is the type of situation or the things that can happen that can stress somebody out to no end. People would think something like that would be a good problem to have, but depending on the person's situation, you never know what kind of pushes them to the edge. And just helping her understand the power of having options and helping her go through the options, it just made a difference. You just have to learn how to help empower people and help them see the good in what's going on in their situation, because there's always a little good sometimes.
Yeah. And
Yeah.
what I recall, as I remember it, again, and this is going back in the memory banks, is that you and she worked together a plan that she would eliminate one university a day, every day, and she could not revisit those decisions.
Okay.
She was narrowing it down and getting to that conclusion by the end. But this idea that I think is pretty revolutionary, John, that the person is the one who decides it's a crisis. We're not like, do you meet the criteria to be calling this line or receiving this service, John?
Yeah, and you got to be prepared for anybody with anything at any time, and that's actually one of the things that I would imagine, and as I've heard from many of our counselors, that makes it keeps you on your toes and makes it also really interesting. You just can't predict what your day is going to be like, uh, based on what happened yesterday or even the previous call. I was listening to Dan Fichter talk about his survey with crisis counselors on the Crisis Jam, David, and he had this quote that I'm curious about what you think, Angela. He said, I had an opportunity, and this is from a crisis counselor he interviewed. He said, I had an opportunity to say, I'm proud of you towards the end of conversing with a 12-year-old, and they said, "Thank you. No one ever tells me that."
Mm.
Do you have any recollections of calls that kind of stuck with you? Things that happened on a call that, again, you can't predict what's going to happen, but sometimes, not only are you a blessing, but they give you something that stays with you.
Hmm. Um, wow. I think one of the most impactful times for me, I think I mentioned it earlier, was some of the calls we received during Hurricane Katrina. And just some of those calls, they were pretty difficult, but the strength that some of the people that were going through, some of the things that they were going through at that time, they were calling for resources, but they had been through such tremendous situations, and just us being able to kind of talk to them and walk them to the resources. And they weren't even as, what I'm trying to say, they weren't as upset about, they were upset. They weren't as upset at that time about what had happened to them as they were concerned about making it through. And just the strength that they had during those times, I think were probably some of the most impactful calls and memorable ones for me.
Yeah.
Those were some really, really powerful moments.
Well, the working in those disaster moments, and David, you know this, that back in the days when I was administering New York City's LifeNet during 9/11, and that was the largest disaster mental health response in the nation's history. But what we were involved in for the next 3 years, and every crisis counselor that answered those phones during that period, Angela, the unique thing about disaster response for especially people who are in the community responding and live in the community that was affected is that you're going through it too. And so there is, and this is what we found also right after 9/11 is the day and 2 or 3 days after the towers fell, what we weren't getting calls for help. We were getting calls for helpers who wanted to help. And because that's what you do when you feel helpless, is it's like, I need to help somebody.
Right.
And so, people like you, me, David, this is what we have to do when these kinds of things happen. And that is a blessing, don't you think, to be in a position where, even you to some degree might feel helpless, but there is something you can do to help.
Yeah, it's actually a privilege. It's a privilege to be able to hear somebody's story and for them to trust you enough with their story. Mm-hmm. Yeah, it's actually a privilege.
Angela,
that's really well put. I got to say, Dan Fichter said that same thing. Here's a crisis counselor that said, I get to make real human connections with people who are struggling and be a buffer between them and suicide. I get to witness the power of the human will to overcome feelings of hopelessness, suicidality, and powerlessness.
Yeah.
I get to do that.
Mm-hmm.
Is a privilege.
It's a privilege.
This builds a little bit on that, Angela, but think back to that experience of those years as a crisis counselor. What did you love the most, and what did you loathe the most? What was gave you joy and gave you pain?
Joy was when, after speaking with someone, and they would, I guess this kind of speaks to that earlier question, they would say something like, "Thank you for a reason to live," helping you to understand that you helped made a difference in their life. That was a wonderful feeling. What did I loathe? When you could not find the resource, or we did not have the support for the person in that moment, in that time.
Well, and we didn't have a readily available mobile crisis service.
Correct.
At that time, there was a mobile crisis provider with very limited capacity. Angela, you correct me if I'm misremembering this, but we had to, if we wanted to send mobile crisis out, we had to fax a referral. they would put together a staffing, and some 45 minutes later, they would
Hmm.
let us know whether or not they might consider going out, and they might try to call the person. And we're like, well, we're on the phone with the person. So it just
Right.
not having those resources and supports was, and Atlanta actually had more than I think most communities even at that time, but so
Okay.
many occasions where it was challenging.
Yeah. That's what I loathe.
That at the time, John, we had these binders on the desks. And as we grew, there were more and more binders. Initially, it was just Fulton County. There was a Fulton County binder. And then there was a Clayton County binder, and they just proliferated. And I remember, Angela, even though we had a software system, you would use that binder for resources. And I remember, Angela, you'd find there was a new number for a certain agency, and you'd make a note in your binder, but then it's not in my binder.
Right.
Yeah,
Yes.
back in those days, John.
But we would try to share, but that didn't always happen.
Yeah.
Yeah. Hmm.
Yeah, but I think one of the things that you said too, Angela, and I did find, even though there is, we hear a lot about turnover among crisis counselors, but at the crisis center in New York City, I was really surprised at how many of our counselors stuck around for an extended period of time. And one of the things that I heard them say was just what you were saying, and that is that, I can say at the end of the day that there was a few people, at least a few, who by the end of our conversation were saying, "Thank you. You really made a
Yes.
difference for me today."
Hmm.
And some people who said, "You gave me a reason to live," and that happened frequently, if not every day.
Hmm.
And to have those kinds of experiences where you have an immediate and significant impact on somebody's life, I mean, how many people can say that about their job?
And John, interesting though that what Angela said was stressful to her is when you felt
Not
like
being
your
able
hands
to,
were tied in being
right?
able to help. So, John, you referenced people who have worked for long term. I actually got a letter in the last few weeks from a staff member, and I'm gonna let me read some portions of it here. For the past 16 years, I've worked here as a crisis counselor. During that time, I've had the most humbling of experiences serving those in need in some of the most desperate, chaotic, and near fatal situations imaginable. I've had the privilege of working with people in active crisis literally all over the world. People have called from Hawaii, Canada, France, England, China, Japan, and veterans in active duties overseas. The reach of our state's crisis services definitely can't be denied. I've been given the privilege of being asked to assist with high alert cases involving requests from the FBI. Appreciate the agency for giving me the opportunity to utilize my training skills to mentor new staff and new hires. Lastly, I've had the added bonus of experiencing the absolute best camaraderie with coworkers and leadership management teams throughout the years, and that has blossomed into treasured, lasting friendships. Angela, what of that resonates for you, or doesn't?
It does. The fact that the person recognized that it's a privilege. I mean, I guess I just can't say that enough, that it's special that, again, someone trusts you enough to share their most intimate secrets and issues that are going on with them in relation to their life, and are asking you to assist them with that. A complete stranger. Now, I do know that they are in a time of desperation, but at the same time, they still didn't have to call, and they still didn't have to share to the details that they do.
Yeah.
You
Yeah.
know, Angela, just thinking back on something that Dan Fichter found when he did the survey of folks, it's the thing that's also hard, what that he heard from crisis counselors was when they would get a calls from people who were purposely, intentionally abusive to them, and sexually abusive in particular, and that was really wearing on them. And one thing that he mentioned in passing that I think is also a real situation that is not the case when you were working, is that so many of our crisis counselors are now working remotely. They're not in a center
Right.
with other
Right.
counselors next to them.
Okay.
So I wonder, how can you imagine what that might be like for you, if you were not working side by side with people? Was that something that was really important for you? And what kind of suggestions or advice might you have for counselors and supervisors these days who are working remotely on how to deal with situations like this?
First of all, yes, it made a big difference for us to have the support of one another, to be able to just look at another person and y'all breathe together,
Yeah.
and for them to tell you it's okay, it's going to be okay, and whoo, and kind of woosah together. It made a big difference. At some point, and I'm not sure if I did it when we were still if we did it when we were that small cube, or if this didn't happen until we grew, but supervisors have to create boundaries for the callers to support their workers. They now, if a person begins to become abusive, we listen only for a little while, and then we share with them, if you continue to say yada yada yada, then I will have to disconnect. I really want to help you. We eventually kind of got to that, and I think that administration and leaders need to understand that they have to support their staff in that manner, because if they don't, they will consistently and continually be abused.
Yes.
Wow.
That's great. That is what Dan said. That was his big recommendation. Exactly what you're talking about, Angela, is that too often they found that supervisors, and it didn't happen often, but too often, that
Mm-hmm.
they didn't provide those kind of boundaries. They didn't say, look, you need to just, this is how you need to get rid of these folks,
Yeah.
and do that in a respectful way.
Yeah.
But yeah, you should not, and you should not be subjecting yourself to abuse because you're trying to help people.
So
Correct.
these are life-saving services, John, but our crisis staff are also putting themselves out there, right? And you
Yes.
don't have to be going out as a mobile staff worker to be,
Yeah.
again, I think it's the same conversation we're talking about 911 dispatchers, that they are first responders. And our crisis call takers, chat takers, text takers are first responders. So standing behind them, Angela, is what we're hearing
Yes.
is something that's vitally important. And finding that balance was supporting people who are vulnerable and in pain, but not tolerating the abuse or violation of our workers. So
And can I ask something real quick? You said standing behind them. Supervisors that when they are present and can hear a call, or are aware that a worker is going through something, we actually, and David, you might have been one of them, I don't remember, but sometimes people would come and literally stand behind us in the middle of something very, very, very intense. And
you know,
doing that.
Angela, when John referenced that we've gone virtual, I watched your eyes, and it was a little bit, oh my God. But that's what
Yeah.
happened. And Behavioral Health Link was like all the other crisis call centers across the country. In that March, April of 2020, we
Mm-hmm.
had hundreds of staff who went to that office in downtown Atlanta on Peachtree Street. And
Mm-hmm.
then we had to keep going. We had to keep answering calls, texts, and chats,
Mm-hmm.
and we couldn't do it in a face-to-face sort of environment. So,
Okay.
in the course of a week, we moved to virtual. And most centers nationally, John, most staff are still virtual, and grappling with how do we provide the kind of, you referenced that, looking over the cube, and we had both electronic and person to person ways of flagging support and getting each other involved. And
Yeah.
that team was there holding your hands up.
Yeah.
You remember that very clearly.
I
So
remember that. Yes.
I could see your eyes when you were like, how would that work?
Mm-hmm.
Uh, and it's a challenge we're working through, John.
Yeah.
And many staff also, there, of course, there are benefits, Angela, in that you're not fighting that Atlanta traffic for 45
Absolutely.
minutes or an hour, and you're able to balance some other family home issues with dedicated support, but it creates more flexibility. And so it is a mix of pros and cons that we're grappling with, but it is the new world that we're all living in together.
Yeah.
Yeah.
And David, just thinking about it, yes, we know that we can help and support people remotely because that's what hotlines do. I mean, that is what a hotline does, is it helps people remotely on the phone or text or chat. So how do we set up a system where our supervisors and our colleagues can also be there with us and for us remotely through technology? It's not the same as being there, physically, where you can put a hand on a shoulder or something like that. But that doesn't mean that that isn't meaningful. And also, I mean, again, we know that having a conversation by phone or by Zoom,
Yeah.
now, or
Shooting somebody a chat even after
yeah,
they've had a difficult time. You can do that.
absolutely.
Well, John, you and I have been doing this work for a minute, and we both started out as crisis workers ourselves, and there wasn't any kind of support or follow up at the very beginning. My first crisis call, Angela, was 1995. I
Okay.
was an assistant pastor at the time, and it was someone in the congregation calling to say goodbye. They were holding a shotgun
Hmm.
when they called me, and I had just graduated with my master's in counseling and was really feeling my oats. And then suddenly I'm there on my own, trying to figure out what to do to engage this individual and grappling. And so that support, uh, that's that's like the whole thing, John.
Yes, it
Yeah.
is. Hey, something I read today that I'm dying to see. I just saw a movie came out that was directed by Steve Buscemi. I don't know if you all know who
Yeah,
he
of
is.
course.
He's a fellow Brooklynite, and it's called The Listener, and it is about a helpline counselor. There's only one person in the film. It's the helpline counselor,
Oh,
and she's
wow.
and she's picking up calls. And this was just released this weekend. I'm dying to see that, and I really that is something that perhaps we should have a follow up conversation later, because I'd love to hear some counselors responding to that and say that whether that felt like an accurate depiction or not. But by all accounts, it looks pretty powerful.
Well, John, let's get let's do a movie review, John. Why
Mhm.
don't you watch the film and come back on the podcast? So,
I'd
John,
love to.
of course, we're thrilled to have Angela today as we pay tribute to crisis workers. I know where I was going just a minute ago, Angela, and I lost my train of thought. Um,
Hmm.
you worked in crisis counseling for about 7 years. The letter I just read was from someone who's done it for 16 years, but is moving on to something else because it is stressful work. It's rewarding work. But what's your thought on it? Are there people who would do this as a career lifelong? Or is it more common that people can give a certain number of years to this direct work, given the combination of reward and stress? What's your thinking on that, reflecting back on your experience?
My thought that it's more common that they would just give a limited a number of years. But there are some folks that remain. There are some folks that I trained at the single point of entry, behavioral health link, that are still there.
Wow.
Yeah, it's only a few, but they are still there, and they are still on the phone. I'm not saying moved up into administration. Yeah, so there are some that are able to do that, but I think most people are only able to do it for a set amount of years.
Yeah,
It's just only so much that one can
and
ingest.
Angela, for Georgia, given the way that they have a preliminary licensure for both social work and counseling, many
Yes,
individuals use that. They cut their teeth in gaining their crisis skills
hmm,
on the front lines, right?
yes,
So it becomes a powerful. And of course, they learn technology and telephony and the triage and crisis intervention. So these are powerful skills that people can gain, and some use it as a stepping stone. Many have done that over the course of years.
Yeah, when you're applying for another job, I'm gonna be honest with you. When you tell them that you worked for Georgia Crisis and Access Line, which is called now, or a single point of entry, they go, really? Because they know you have a skill set in so many areas.
Yeah.
Yeah.
Angela, one thing this kind of goes back to what I was saying earlier about some of those folks in the field who say, yeah, the best training I ever got for suicide prevention was at a crisis center. Uh, is that there's also really fascinating research that shows that that a lot of when you compared volunteers to mental health professionals doing this crisis hotline work, that volunteers somewhat outperformed. When you look at
Mhm.
that more closely, one of the things that really comes to mind is that, well, you know why? Because people, mental health professionals are not getting trained to do what you're getting trained to do. It is a different skill that they need to learn and apply. And so if they come in with the expectations or the arrogance that says, I know what to do and how to do it, and don't feel like they need to learn anything new
Mhm.
or be trained, as
Mhm.
opposed to somebody who's coming in cold. So I wonder what you think about that, and what sticks with you today in terms of some of the lessons you learned and you've applied as a mental health professional when you were working at VHL.
Now, are you saying that in relation to like a volunteer, or
Well,
you just saying in general?
just in general, because I think what happens is that a lot of professionals say, I don't need to learn anything, but you weren't that way. You learned something. You said, no, this is something, and and I think there's a whole new standard of care for mental health professionals now working the crisis lines. There is very specific training for them, and evidence has shown what they need to do and how they need to do it. So that is changing. This was old research,
Yeah.
but it is instructive in terms of, coming in and not believing that all of your traditional mental health instruction is going to save you here. So I'm curious,
Yeah.
what did you learn as a crisis counselor that taught you something that you didn't know in your mental health training that is still with you today?
I think I became a better listener, and I also think that I became more aware of what people don't say as much as what they do say, because people leave out a few things, and when you ask them that, then it's a lot of times that's the piece to the puzzle to help you figure out how to help them. So what they don't say is very important. That's one thing I definitely remember walking away with. uh,
Interesting.
mm-hmm.
So John, look, you're referencing Brian Mashara's some of Brian Mashara's work, and he and I used to spar on this very issue because we employed exclusively
We
clinicians
did too. We did too.
back when those discussions were first going on. And another piece of that is the clinicians are largely working full 40-hour shifts where volunteers are coming in on
Exactly.
more limited basis. So there's
There's a
some other
number of
other
factors.
things in play there. But as we go forward, Angela, we're going to have all kinds of mix. Now, if you are one of those staff working at Behavioral Health Link, this podcast is for you. But we're not only going to have people who work in the crisis industry. We're going to have researchers like Brian Mashara, who's scheduled to come on the podcast. John, we released this Moving America's Soul and a suicide documentary series about telling the stories of people lived experience. So we're going to have Professor Thomas Niederkordenthaler come on, John, talk Papageno effect and the value of lived experience. So we're going to have a rich array of stories and speakers on this podcast. And Angela, we hope you'll join us again. So,
Thank you
but
for having me.
John, back when Angela was there, we had the very first version of what was it at that time called single point of entry. We're now on the third generation, and you and Dr. Chuck, as we go back to our sponsor to close out this program, you've been working on developing that tool that is not only supporting the coordination of crisis care, but empowering that crisis worker.
Yeah.
And that extends to mobile crisis teams as well. We have the same thing for
Right.
both mobile crisis and that call center agent who's supporting them. In fact, that software is currently supporting 7,000 crisis staff across multiple organizations in 13 states. John, as you think about that work that you and Dr. Chuck and Michael Clays and others are doing, what are you most proud of as we're going forward? I saw a number of things that
Oh
were
my
intriguing
gosh,
to me
there's so
that if
many
I was
things.
working the phones today,
Yeah.
I would love. But what are you most proud of?
Well, the person-centered nature of it is really important. I mean, when we thought about all these years looking at research on what works and what doesn't in crisis services, we thought, how is it that we can establish standards of care and make those a part of every clinician who's doing crisis work? How can we make it a part of the real-time interactions with people? Otherwise, they're just going to sit on the shelf. And this was a means for doing so. Is that not we were able to build into the DNA of the software the best practices. So when a person like Angela, you're working with somebody in real time,
Mm-hmm.
it can influence you and this person's relationship, because that's always in the center of this care. And we can't have any distractions. What we need is something that's going to help you be there for them, and be there for them in a way that says, by the way, Angela, don't forget to do this. This could be helpful, in a way that's not obtrusive, and also makes all the documentation burdens go away. It makes it very, very easy and seamless to do that. So keeping it, allowing it to be person-centered and also quality-centered. Those are the things that I think I'm most proud of, David.
And John, how do people learn more about the Behavioral Health Link crisis platform?
Well, you just got to go to the website, behavioralhealthlink.com.
Terrific, terrific. So, John, Bill Maher ends with new rules. We're going to end with the plain truth. And John and I are going to rotate on these as we go along, Angela. But today's plain truth I'm going to take on, and I'm going to share my screen here a little bit. In the spring of 2020, we had to go virtual. Angela, we were talking about that earlier,
Mm-hmm.
and it was pretty quick that we had times that in multiple states you weren't allowed to even be out on the road unless you were what, John? What did they?
Oh, in 2020, you weren't allowed to be on the road, and well, I mean,
Unless you were.
unless
They
you had
had
a
a
mask.
phrase,
Let's say that again.
essential worker.
Oh,
You had to
well,
be an essential worker. And first responders were considered essential workers. But I remember at the time, John, the Crisis Jam Learning Community, we put out letters that people could utilize, that staff could carry with them, that in fact, crisis call staff, mobile crisis workers, crisis facilities workers were essential workers.
yes.
They are and were first responders. They're, that old sayings about the mail carriers are not stopped by the weather or the dog or whatever. We rely on police. We rely on EMTs. We rely on firefighters and ambulances to save lives and to reduce suffering. And even when there's a marathon through a city, the death rates increase because ambulances routes are cut off.
Mm-hmm.
The speed of which we get these professionals to the scene makes a difference. And what we've learned is if you're a crisis worker, that's the work you're doing and the impact that you're making. And Angela, I know you were there back in 2004 when we had 4 hurricanes in a row They charted up the east side, they charted up the west side of Florida, but they all went through Atlanta.
Yeah.
And we had unprecedented level of rain and flooding that there were times that our basement in the Citizen Trust Bank building flooded out the elevators. There were a couple of times, I think once we had to vacate for 45 minutes and then had to develop the systems where we could continue to answer the phones no matter what happened. But the staff continued to make it in. In 2008, were you there for the tornado, Angela?
Yeah, I was there. I might have been more part-time at that time.
So the staff, we were on the 9th floor at the time, Angela. The tornado hit. There was a NCAA basketball game occurring.
Yes, I was there. I do remember that because I remember the floods of texts I received from family. Yes.
Yeah. And the tornado, if the game hadn't been overtime, we probably would have had lives lost because it hit the CNN building.
Yes.
And it came down the hill. And Grady Hospital, where you see the 75 interstate sign, the BHL was just where that 75 sign is. And Grady Hospital is just below it. Michael Clays was at Grady. We were at Behavioral Health Link, John. And I was in Nashville communicating with the crisis center director on the phone the entire time. And we misunderstood. The staff went downstairs for a brief minute and came back up. They actually came back up when the tornado hit. So we were a little bit out of sync. But the crisis director saw a pair of men's pants go past the windows on the 9th floor there. We had all of our the cars that were parked on the upper deck had their windows blown out. And a apartment building right across the freeway had the top floor just raised off. And there was nobody in that top floor yet. It was being built out, but it just was. So the staff worked straight through that. And then do you remember Snowmageddon, Angela?
Yes, I don't think I was at BHL, but I remember it though.
Well, Snowmageddon, John, we just had a few inches of snow and ice, but it's Atlanta. And everybody was released at the same time. And the freeways just, I'm not making this up, they just stopped. And there were people, after about 8 or 10 hours, fuel started running out and people just got out of their cars and walked away. They just left them on the freeway. It was the worst disaster. And look, the law enforcement was saying, don't stay off the roads. I remember having at the time, the call center director called me and said, okay, the health plan call center is shutting down. They went through all of these call centers that were shutting down. And so we're going to shut down. And I said, okay, so just one quick question. Is 911 shutting down? And he said, what does that matter? Because and again, this is before 988, John, but we're the 911 for people with a mental health crisis, a substance use crisis, a suicidal crisis. And Angela, with rare exception in the 25 plus years we've been doing this, we just haven't walked away. People stay downtown and stay at a hotel nearby back when we were all together. So the work that you do, if you're a crisis worker, we need to continue to press that you are recognized for the value of your work, like law enforcement, like ambulances, like firefighters, because you are saving lives, you're reducing suffering, you're providing support, you're putting yourself in the position to engage and collaborate with someone and be able to say, John, I'm proud of you. You're not alone. We're here with you. So we so value the work that all of you're doing. And John, in many degrees, this podcast is going to, while we'll focus on different themes from week to week, it will, in an ongoing fashion, be a tribute to those who are in this industry, who use these services and provide these services.
And David, this message of Angela, you are a first responder and all of our crisis workers are a first responder, is so apt because you all, and I want to thank you and every one of you doing this work who are brave enough to run into those psychic burning buildings, grab people by the hand and let them know that they are not alone and pull them out to a cooler place where they can see it tomorrow.
Angela, thanks so much for joining us. Great to see you again. Those were some fun times, Angela, and it was great to reminisce on those a little bit. John, I believe our guest next week is Dr. Richard McKeon.
Richard who?
John and I have been working with Richard. Richard is one of those visionary leaders who set the stage for this next generation of transformative care. And we hope you'll join us on the 988 Lifeline podcast next time. Thanks so much.